Dr. Shizuka Ko from Osaka University, and she's going to tell us what is new in dry eye imaging.
Any other connector? Oh, yeah. Okay. Okay. Good morning, everybody. Okay, my name is Shizuka Ko from Osaka University, Japan. It is my great honor to be invited here to give a talk today. My talk today is dry eye imaging, what is new. Visual complaints are common among the dry eye patients in our clinical practice, as you know. Common visual complaints include fluctuating vision with the blink, glare, blurred vision, and eye fatigue. But however, since these subjective symptoms are generally common in your patients who visit eye clinics, unfortunately, some dry eye cases may be diagnosed as unidentified troublesome complaints. The tear film and ocular surface is very important optical element of the eye. The tear film is actually, since the tear film is the first refracting surface of the eye, it is actually plays a very important role. In healthy eye, smooth, clear optical surface is formed by every single blink. However, once the tear film actually breaks up and exposes the rough surface of the cornea, it actually results in irregular optical surface leading to the visual, irregular actually visual function. So there is another reason why actually dry eye patients actually are undiagnosed, because although visual complaints are very common among the dry eye patients, standard visual acuity tests cannot detect visual disturbance in dry eye, because most of the dry eye patients have good visual quality, at least measured with standard visual acuity. But recently, as you know, there's a number of numerous advances in corneal topography and wavefront sensing. Actually, it can help us to measure optical quality objectively, and also it enables us to measure the optical quality measurement continuously, better to understand how the ocular surface in dry eye actually influences quality of vision. So in my talk, what I'd like to actually share with you, based on our previous study, what is known and what advances have been made in evaluating and understanding quality of vision in dry eye. You may have such experience. So this is the Placido-based topographer maps. So since the Placido topographer uses reflection of mirroring images projected into the air tear film interface, in dry eye, you may have you may actually observe such kind of tear film induced topographic changes. This is actually the one female patient. She was actually referred as keratoconus suspect. You may actually suspect keratoconus, but the other actually tomographic or other assessment actually was actually diagnosed. She is not real keratoconus. Actually, you can see the corneal epithelial damage in the lower part of the cornea. It may actually cause some kind of keratoconus-like topographic changes in dry eye. Shown here is actually our previous study. Actually, we use a Fourier analysis actually to analyze corneal irregular astigmatism in dry eye. So Fourier analysis can separately quantify the refractive components of the cornea. So red box is the original topographic map. Then it can actually it is actually decomposed into spherical regular astigmatism, asymmetric component, and higher order irregularity. Blue boxes actually include asymmetric components and higher order irregular components. These are actually regarded as irregular astigmatism. If you look at the irregular astigmatism in normal eye and dry eye, you can see the color changes in dry eye. So Fourier analysis actually can detect the corneal irregular astigmatism in dry eye quantitatively. We investigate the association between the corneal epithelial damage and corneal irregular astigmatism in dry eye. We actually graded the corneal epithelial damage based on the NEI scale, and grade 0 and grade 1 and grade 2 or 3. So what we found is actually the asymmetric components and higher order irregularity components actually correlated with the severity of corneal epithelial damage. Now I'd like to show you the continuous corneal topographic measurement. There is a device which can measure the topographic corneal maps continuously. The left side is the sequential topographic maps in normal. You can see the almost normal topographic maps. But in dry eye, if we actually measure the topographic measurement every second, you can see the kind of changes with time in dry eye. Actually, previously, we actually measured the higher aberration before and after tear film breakup to investigate the tear film breakup, effect of tear film breakup actually on higher order aberrations. As you know, higher order aberration cannot be detected by visual acuity test, and higher order aberration cannot be corrected by glasses. So these images are actually obtained by in normal eye. Before the tear film breakup, you can see the irregular wavefront spot pattern. But after the tear film breakup, you can see the distorted spot pattern here. And also, if you compare the higher order aberrations, significantly we observe the increase of higher order aberration after the tear film breakup. So tear film breakup actually affect higher order aberrations. So we actually developed the previously we developed the machine to device to measure the wavefront aberration continuously. These are the images from normal eye and dry eye with Sjogren syndrome. So we measure the wavefront aberration every second for 10 seconds. So if you look at the normal eye, you can see the stable wavefront aberration map, and also the simulated retinal images are almost stable. But if you look at the dry eye, you can see the kind of many red and blue colors from the beginning, right after the blink, and also simulated retinal images are very actually blurred retinal image. So you can know, okay, dry eye has actually decreased retinal image. So, wavefront sensors can evaluate aberration of the whole eye quantitatively. Now, let me share with you tear film breakup pattern. Actually, this is very simple technique. No machine, just with fluorescent. Fluorescent you have everywhere, and everybody have a fluorescent paper at your street lamp. Very simple technique. No updated one, but very simple. But I like very much. I believe all the corneal specialists like fluorescence technique. Okay, so recently, Professor Yoko in Japan proposed 5 different tear film breakup patterns. Actually, he increased one more type, but right now, I just explain 5 different patterns. So this is we call area break. So upward movement of the fluorescent is not observed or limitedly observed within the lower part of the cornea. Right after the blink, you already you can observe the tear film breakup whole the cornea. This is associated with a severe type of aqueous tear deficient dry eye. Okay. This is the line break. Line break is associated with the mild or moderate type aqueous tear deficient dry eye. You can see the kind of linear break in the lower part of the cornea with the fluorescent upward movement. So this is a spot break pattern. You can see the round break right after the blink. It is associated with the severe dry eye with decreased wettability of the ocular surface. So this is we call dimple break. Actually, an irregular but vertical line, linear-like shape during the upward movement of the fluorescent within the central part of the cornea can be observed. You can see the breakup. So this is associated with mild or moderate dry eye with decreased wettability of the ocular surface. So the last one is we call random break. Random break is associated with evaporative dry eye. An irregular irregular shape occurs after the cessation of upward movement of fluorescent. So after the fluorescent movement, you can observe the tear film breakup. So this is a summary of these tear film breakup patterns. So based on, if you observe the tear film breakup pattern, just using the fluorescent technique, fluorescent paper, you can classify dry eye into 3 patterns: aqueous tear deficient dry eye with decreased wettability, and evaporative dry eye. Aqueous tear deficient dry eye is insufficient component is aqueous tears. In dry eye with decreased wettability, insufficient component of the ocular surface is membrane-associated mucin. And in evaporative dry eye, insufficient component of the ocular surface is thought to be lipid or secretory mucin. And again, area break is associated with severe type of aqueous tear deficient dry eye, and line break is associated with mild or moderate aqueous tear deficient dry eye. And spot break is associated with severe type of dry eye with decreased wettability. Very, very kind of characteristic. And dimple break is associated with mild to moderate dry eye with decreased wettability. And random break is even in normal eye, we can observe such kind of pattern. This is associated with evaporative dry eye, such as dry eye comes with MGD. Now, because I like optical quality, so I investigated relationship between the tear film breakup pattern and quality vision. Again, severe type of aqueous tear deficient dry eye, because in such cases, many severe cases, they have a lot of corneal epithelial damage, like including the central part of the cornea. So in that case, right after the blink, you can see the increase of higher duration. But because in such cases, the tear film is very, very their film thickness is very thin, and there is no tears, so A Castillo is insufficient. So you cannot see the kind of changes in higher aberration. So actually, blurred retinal image is actually almost continues for the 10 seconds. But if you look at the line break, mild moderate actually A Castillo deficient dry eye. In such cases, especially if you don't see the corneal epithelial damage in the central part of the cornea, it looks like normal at the beginning, but also this is because this is A Castillo deficiency. There is no tear, so there is no change. So it looks like if there is no SPK in the central part of the cornea, there is no increase of higher aberrations. And for the spot break, severe type of dry eye with decreased wettability, actually this tear breakup is too fast to be detected. So far, current actually commercially available Wavefront machine cannot detect the optical quality. But for the dimple break, mild to moderate dry eye with decreased wettability. So right after the blink, actually the tear film is covered, corneal surface is covered by tear film, and you can see the nice images at the beginning. But after, with time, tear film stability actually decreases, so the higher aberration increases after the blink. It can explain a fluctuating vision with the blink. For the evaporative dry, it depends on the length of the BUT. So if the BUT is longer than 10 seconds, actually you can expect actually kind of stable pattern. But if the BUT is less than 10 seconds, it may be actually, we may actually observe such kind of increasing pattern of higher aberrations. As you know, recently, ASCRS actually proposed an algorithm for the operative diagnosis and treatment of ocular surface disorders. According to this paper, actually dry eye may compromise the results of corneal, cataract, and refractive surgery. So as I mentioned today, dry eye can adversely affect the refractive measurements before surgery. So we must actually check the dry eye and ocular surface before surgery very carefully. This is my last slide. So quantifying optical quality with corneal topographic or wavefront analysis can objectively demonstrate that both tear film stability and ocular surface damage degrade quality of vision in dry eye. Thank you for your attention.
Are there any questions for Dr. Ko? So Shizuka, how do you manage patients prior to cataract surgery? Do you routinely look at their ocular surface? Do you obtain their measurements first? What's your workflow for evaluating these patients?
Actually, in Japan, unlike United States, we don't have actually inflammation kit or something like this. But so we basically actually of course we check the ocular surface with fluorescent, and we measure the tear film breakup time, and also as I shown today, we also observe the tear film breakup pattern, because if we actually identify dry eye before the surgery, we have to actually manage dry eye first, and also based on the pattern, we actually give the patient the optimal treatment. Yes.
Thank you. That is a very interesting talk. So based on your findings, what drops do you choose for the evaporative dry eye, for the mucin deficient dry eye?
You mean the treatment? Or
Yes.
Treatment. Okay. I think probably it actually depends on the actually country, because some eye drops are available or sometimes are not available. But in Japan, so you mean the evaporative or all the kind of dry eye, or no? Three groups. Okay, three groups. Okay, a bit. So A Castillo deficient dry eye, because this type is actually insufficient component is aqueous. So we need we actually supplementation of actually what aqueous is needed. So if especially for the severe case, I recommend punctal plug, because such cases actually it is very difficult to actually just to treat with the artificial tear, but for the mild to moderate type of dry eye, actually in Japan we have G-fossil eye drops actually which can secrete mucin and aqueous tear. But here I know some actually mild cases of aqueous tear deficient dry eye. Hyaluronate actually sodium natrium is also available. I think it can work. But for the dry eye with decreased wettability, I think this type of dry eye need mucin. So mucin actually stimulation, the eye drop which can stimulate mucin is actually needed for such kind of patient. For evaporative dry eye, it depends on the insufficient components. Some people actually need some lipid, or some people need aqueous tear, and some people need mucin. And based on the I think we can actually supply individual cases. Yes, maybe we can discuss later.
Any other questions? Otherwise,
Sorry to ask you again. Specifically for mucin deficiency dry eye, which we can find out by the blink pattern, which particular drop do you prescribe when you feel the patient has got mucin deficiency?
So you mean the treatment? Treatment. Right now in Japan, we have commercial available drops to secrete mucin is ribamipide, but I know India has in India there are some domestic ribamipide, but I'm not sure. I have no experience using drops here. But in Japan, we actually use ribamipide and also G-fossil. G-fossil is it can actually secrete mucin and water. So both ribamipide and G-fossil.
great. Thank you. Okay, our final speaker is Tushara